emergence of the COVID-19 pandemic and its rapid spread across the world has adversely affected the health sector in general, especially response and treatment of non-communicable diseases (NCDs). Evidence so far show a clear link between non-communicable diseases and COVID-19, as people with pre-existing non-communicable diseases appear to be more vulnerable to becoming severely ill or even dying from the virus, according to the World Health Organization (WHO) Report 2020 on the impact of the COVID-19 pandemic on non-communicable diseases, resources, and services. The study shows that in the majority of countries, essential services for hypertension management, diabetes, or cancers have been disrupted, drawing attention to countries with an NCD burden and leaving millions of people medically unattended to. In an interview with a clinician, chairperson of the Ghana Non-Communicable Disease Alliance and CEO of the Peace and Love Hospitals, Dr. Beatrice Adai, said the effect of the COVID-19 pandemic on non-communicable diseases and the health sector globally and in Ghana cannot be overemphasized. She called on policymakers and stakeholders in the health sector to pay particular attention to the treatment of non-communicable diseases with the advent of the COVID-19 pandemic. According to her, the COVID-19 disease has had adverse effects on patients with history of non-communicable diseases, including breast and cervical cancers, hypertension, diabetes, kidney, cardiovascular diseases, among many others. She noted that the neglect of the non-communicable diseases (NCDs) with the arrival of the COVID-19 pandemic makes patients living with NCDs vulnerable to the COVID-19 disease, and this has led to the high mortality rate in affected countries, including Ghana.
COVID-19 has had a very devastating effect on every facet of our economy. And so for the health sector, it has affected us a lot. We were not prepared. Not enough hospitals, not enough ICUs, not enough manpower. And the COVID has also taken away a lot of our manpower. A lot of doctors, a lot of nurses, healthcare professionals have unfortunately lost the battle to COVID. And this means that we don't have enough personnel to even manage COVID and the complications that come out of COVID. It's true that all attention has been focused on COVID-19. It's important, but we should also not lose sight of the fact that the other diseases, especially the other non-communicable diseases, are still with us. COVID-19 has not come to stop any of them. It has rather come to worsen an already bad situation. We know that persons living with the NCDs are more at risk of developing COVID-19, and they develop the complications out of COVID-19. So it's important that as we look at COVID-19, we also look at the non-communicable diseases. A lot of patients were scared to go to the hospitals. A lot of treatments were disrupted. A lot of diagnoses were not made because of COVID-19 and the fact that most hospitals and clinics were turned into COVID hospitals. And so the staff were not enough to deal with COVID-19 cases and also deal with NCD patients. So a lot of patients were asked to go back home. So they were not getting their treatments, they were not receiving their scheduled medications. It's not a lot of places that you can even get drug refill done. So a lot of complications are coming out of the non-communicable diseases. And a big example are those with cancers, those with hypertension, those with diabetes. these patients need to have their medications regularly. And if they are not getting the medications, it means they are going to get into the complications. We should all start thinking about it. Are we going to put all our eggs in one basket and lose everything? Or can we also handle the NCDs as well? And the second variant is better. We should look at COVID-19 and look at the non-communicable diseases. The same way that the policymakers, the governments came to take diagnosis of COVID-19, take all the treatment of COVID-19 and its complications, I am sure they can also come to the aid of the people living with NCDs and those who are yet to even be diagnosed with the NCDs. The media is always talking about COVID-19 and its complications, rightly so. But please don't let us forget, and I'm happy that GBC is here to spearhead this agenda for people to start thinking about the fact that we need to prevent some of the NCDs, the preventable ones. And these are things that we can do to help ourselves. Throughout the evolution of COVID-19, we realized that a lot of people who were dying from COVID-19 are those with diabetes, hypertension, stroke, cancers, and the other non-communicable diseases. It shows that we should rather pay more attention to those people living with the NCDs, because these are the vulnerable ones. If you come to Africa, the problem we have is that a lot of cancer cases are diagnosed very late. And so that was already a bad situation, and the COVID has made it worse. We also know that cancer treatment needs to go through certain kind of regime. And so if we disrupt it, then it means you are not treating. A lot of surgeries were put on hold. And so it meant that if the person came with even an early stage disease, he or she will have to wait until he gets to a late stage disease. And what it's actually coming out is that the mortality from cancers are going very high. It's not only in Ghana, it's not only in Africa, it's a global thing. It looks as if we are not caring about that. And so we need to sit up and do the right things. We need to encourage people to go to places where they can get their diagnosis and stop this unnecessary pushing away patients. The COVID is fortunately for us under control. And so what can we do to help our people? The cancer cases are getting to too late disease cancers, and it's very difficult to treat such cancers. So the cancers are a problem, and if you are not careful, they are going to blow up on us all.
The CEO of the Peace and Love Hospitals, Dr. Beatrice Rafi Adai, said, for instance, the incidence and mortality of breast cancer, which is #1 killer non-communicable disease among women around the globe, is on the rise. Thus, she said that early detection could help in early treatment.
We narrow it down to breast cancer. We still don't know the cause of the disease, but it's the #1 killer disease among women globally. What we also know is that when you go to the developed countries, the overall incidence is on the rise, but mortality from breast cancer is reducing in the developed countries. Whereas when you come to us here in Africa and here in Ghana, the overall incidence is on the rise and the mortality is still on the rise. If in 2018 we knew, according to Global Can, that about 1,800 Ghanaian women died annually from breast cancer, the Global Can figure for 2020 shows that more than 2,000 Ghanaian women are dying from breast cancer. So it has moved from 1,008 to more than 2,000 annually. And this is a disease that we are not paying enough attention to, even though women are getting it more, even though a lot of the women are young and so they are in their productivity age. A lot of these women are women with young children, and so we should see it as a matter of public health concern, a matter of developmental issue, because most of these women are breadwinners of their families. So if these women are getting the disease and dying, then it means we are not doing something right. And I want us to start thinking about it. The disease is still not painful. Women should not stay at home with lumps in their breast and think that once there's no pain, there's no danger. That is what is killing our women. They find the lumps themselves. I think thanks to Breast Care International and activities of GTV and all that you've been doing, a lot of women have heard about breast cancer. They know that they have to check their breast. But when they find something, when they find an abnormality, they think once it's not painful, there's no danger. We want to send this information to our women out there that even if it's the size of an orange seed and it's not painful, please go to a hospital. Let's check for you. The earlier we see a lump in the breast, the higher the chances that we can cure if even it's cancer. And if we diagnose cancer at the early age, we don't remove the whole breast. I want to encourage our women to come early to the hospital when they found some lump or some abnormal discharge or some abnormality in their breast. Because if we find it early, we will preserve the breast for you, even if it's cancer. But if you don't come early, then we have no option than to remove the breast. And even sometimes we cannot do the surgery because maybe at the time that we find the lesion, it has already spread to the vital organs. And breast cancer does not stay in the breast alone. The more you keep it in the breast, the higher the chances of it spreading to the liver, to the lungs, to the brain, and to the bones. And when it spreads to these organs, then treatment moves from a cure state to palliative stage. And that is what we don't want. We want to cure our women, even if it's breast cancer. But if we'll be doing palliative care for all the women, then I'm afraid we are going to lose a lot of lives. We are going to continue to lose their lives. And these lives that we are losing, these more than 2,000 women annually are people's mothers, their aunties, their wives, their sisters, their daughters, and they are not just statistics. They are people, are loved ones. So let's come together to save the lives of these dear ones. If we look at particular cancers, there are preventable cancers, and there are some cancers we can't prevent. Preventable cancers are cervical cancers, liver cancers. We can do something about them to vaccinate our people and not allow them to get the hepatitis B viral infection and the HPV viral infection that can lead to liver cancers and cervical cancers. And the non-preventable cancers, notably the breast cancer and the prostate cancer, we should start creating the needed awareness. We should start screening for them and encourage people to go for treatment so that we will reduce the number of people dying from these cancers.
Here are some breast cancer patients and survivors and what they had to say.
Now the tippings kakra and sana ntimi fa ni sebe 1 year ni echi kakra ni Miti pains ni kakra so na me start to hospital. Na the kami wo ayemi ya. Nti me kami nufu. Na me be sin ko hospital. Me ko instance me insurance no so ewu. This kana me take me be form ni anu me wie no me ko scan. Me wie no na scan anso. Na me san call back. Nti e chiri na me san ye renewal. Me fani say 1 month later. Nti me ko college. So me be koi akoye lab ni anu we na mo si omo say kitu e bi wo we ase nti ji se me san koye no su test. Na su test no calculate scan we ni nyina na afide nti me nko bio ni bi na ma cafe afi baby edo no mi ne hwe ni bu afọ na me wo face a pains ni yi no mo de me call village nti ho na me call to na village na me ye be obi so say an wa ye bi ama obi da mo try a nkoye meniska nti obi na oye me bi pedro kakra bra na oba hu mi wo ho na o se me hu ye me mobonti obe ahwe se obenya NGOs bi ama mea na o ma hwe se o matumi aboa mea nti a kire na onu frɛ se wanya obi mu nti me mpomo se me bra komanse na odi mi bae me de ya re no na me hwehwɛ se matumi aboa me na se bɛkɔ me de me ni eyi bi a hospital yi wenu nti me nim se dru o amatumi akio ama me na ayeye anase mbeye me operation na me de
so ya ha hospital edi kan ye kɔ ha ɔkɔ no wo so nkɔ cape ye kɔ cape ya bai ya zi kɔ report no kɔ ha ye kɔ no wo so ye san fa nkɔ cape ye kɔ ya wo so wo be 15 million ya nye sika ya nkɔ maja ye san ya tenasi ye ebibidura na ye
mi yare enufo cancer bibiduro mi nya hoto na mi nia biba kuba e friend bra lucky ena ba say me ye ready now you nim doctor okwa obeye kama Catherine Samimbra kuma simi ba me hu doctor penny na me hu na ohwe me kama duro ni nyama no o mami a oye mi fa o di mi ka prekrampo anti me dane ase ema ma hu me hu Tommy mi dana se pa ne
akura me are to me no fu ma me bread me ma me nana no nyina bread fe a chiri na abusu nyina akura po di me tepen pime na me kopie doctor wi afia deso efiti sama me no oye mo operation yi yare no ahwe me besi ne me ya ade en bosu ni miru ni me ntwi aka pre e wo ne doctor ho a wa hwe me ama me nya nkwa a ene me so ma be kama fofo
beye infi esia na menya kokram yare a eto emban wona enufum ba medin senya eye ni eya aba ketwa na eda menufu no esoro ha amunum sei nti mi hu na eda ho no so na enye me yawo nti ne mu na me start se me di ebibiduro no me di yesa mi hu se afidi aba no na eye kese nti da ko me ho monum na me nyanku mi beka eche me se onim osofu bi nti ono me beko ho monum na me ko osofu no me ko ho monum obo mi nsu osofu ne nazi wa kan se he ma kotayin no koto nsumu ima no hu sane nti anadwe 12 o'clock baby ena asofu no wa mama asesa nsu eye cross na me de asisi cross na ase nti ahomachi 12 no na me egwar nsu me bo nsu na me bodu baby no enufu no roy beto me ha nti metumi ayi picture no ma obi a wahye edu sa no ewo beto ha monum no na afi de me ntumi ya mo ho hye nti mama afi me ba fi nti e ba ndame no afi na me ntumi shanta no metu mako enipemu Enufu na edu saa no na to mesi me friends mi mu. Ben sheet na me fra. Enufu na amuhu no. Na me ntumi ya me ho hwe eyewe na me ntumi ya me ho hwe. Sa me da kra me bada kra me tenase. Na me diso ndi mienu ato na ma atena ho na ma atabo ma chia me ho na me pege enufu no. Me de ato so. Sa me de say enufu na edam ha mu no me say. Yare no so breast cancer no so ayembema. Me ma me nyanko ni baby ono na onya breast cancer. Nti ono na oba abeto me ewo fie. Eba adam ne de say me pie obi a be hu say na eko. We got so Dr. Wiafi. Na mama bisa me say Joyce na wo call he. Na me say mama mpocha mko ye bibiduro. Na me call mpai boso. Na mama bisa me say Joyce na wo kun wo he. Ya no so ba me kun no dan mi jai. Abra started say eba no na mo 28 years. Me kun no ware me pen so na ya no started. Nti me wo me ba na avia started say eye den pa no. Na me ba no we nya 1 year or 2 years. Na me kun dan mi jai. Nti mama some o kan say Joyce say nya me pa na wo yesu tie dia. Me hwe mo ho ayefe. Nti mama o ti menufu ni bi ko okoye nhwehwemu. Nhwehwemu ba ni na o ka chem say me nya cancer. Abra mi chima ni na ne na mini sese. Nti o ka chem say me nya cancer no. Na o ka chem say eduru bi o fen chemotherapy. O de ba fa nti ni mani na akutia sa cancer emboa no. Nti mama o de bi si me so. Mi bo obi mi ti wi tutu. Mi ye tuntum. Mi wi na mama ga eche mi say. Ma akwa bibiduro nti menufu na asai. Ti se menufu we otwa fu ho. Mama otwa menufu 10 good years ni.
Na menufu ye me ya pa. Sika 70. Na me ntim ko doctor. Nti menu abebe wo Kumasi. Ana wo se bra. Wo mama mbi wa ha. Wo hwe no fo ne mu ya le bra na me fa nkoma no. Na me fa nya ma bibi na wo se we. Ina wada me ba ma bibi ase ma me na nko hospital. Me se ma akobida. O se na wo ko na wo hene. Me se me ko no wodwo me se ka 70. Me ntime ngo be ma se na wo tana ma no fo ye ko. E kira nkoma ya de bra wodwo. De chinye man so ambete me ba ma bibi ambese no so. Mama me to me to and more power wodwo ma pizza lab. Ade me ba Emma o ma yam hon senkyere ne papa kan de o ma ya ma me abro ma bia me ntia se me no fu me kokora na bombo chan na ye den so me toko so ma di ma me chi ba ha and me ntia me nyama ya lesa.
Breast cancer is curable and survivable only when detected early. Myself, I have survived for the past 16 years because I was diagnosed at the early stage. I have my 2 breasts. The tumor was taken off. I had my chemotherapy and my radiation. And by the grace of God, I'm still strong. My advice to all women is that breast cancer does not discriminate. No age limit. Whether educated or whatever, please, my women, the moment you notice any changes in your breast, please go to the hospital. If you are not satisfied at where you went, seek a second opinion at another hospital, but make sure you go to the right place. Make case to say, ye who say breast cancer no yare bi a ye modi no wiase ya hye ne kaka motobi ene ehunu nipa nti oba ne te ho wa hu say yare woni no funu enso wo se me nko hospital da obechini obekwa akoye bibiduro obekwa akotena sorry fie ni ade yen ka se bompaye but wo yare akọ hospital na doctor fo ni nya wo hu adwuma abrekro na no na odin pipe no etechiri enye wonufo aye betwa no ne bekun wo baba bia yare no bedidi akom eno na edi ewuo bebrew enti se wo hu bibi wo wonufo no ma entena so the more wagye ade kro na tena no fo no ade kro no so na ne ti ma yende na or tretre woni beba ho so na beba be pie hospital no na enioma aginsem eyesa oba hospital na emwa na doctor Ford be ma no kakra bi ensai bre no ewo baby ansa no abedru hospital brantem na oba ntem a doctor for no won be ye ho adwuma.
Mrs. Theodosia Jackson advised women to seek early treatment for breast cancers in order to prevent its high mortality among women.
In fact, human nature, we don't have time for our bodies. We only think of money. We only think of our job and other things we do. It baffles me when people visit this hospital and the breast is almost burst and gone. By all means, you will begin to have pain initially, but they will wait and go to prayer camps and go to fetish and other places. When it is at the point of death, then they will look for a doctor to complain to. I'm advising everyone, breast cancer is not the only cancer killing people. Prostate cancer has always also come to worry our men. I'm advising that even when you don't have any pain, we should make time to go for a checkup. I do general screening twice every year. I check my sugar, everything, but some people don't have the time. So you could see that they will get sugar problems and they complain it has never happened. It is there and you don't know, especially we the women. Our breast is very important to us, like the men. Prostate is also very important to them in their makeup. So we shouldn't wait till it is out of hand before we seek medical help. Of late too, I've seen my young ladies. I've seen young girls below 18 years who have come here with breast cancers. Even JSS students with breast cancers. Some are genetical, some too comes unaware. Please, those young beautiful ladies, celebrities who are exposing their breast in competition, don't only expose the breast, go to the hospital and examine what is within. It has become a fashion these days. In Ghana, anything comes and everybody copies. And if we are not careful, in the near future, many of our ladies who are showing their breasts will be shy to go to the hospital for mammograph or something for examination. So I'm pleading. You see, we are teaching the youth about certain things that is not good for the society. Exposing buttocks, breast for the young ones to see that if you have a huge breast, you are the #1 breast holder in Ghana. After all, when you do that, what do you gain? So I'm pleading, whether you are a celebrity or anybody at all, make time, go to the hospital for your breast examination at least once a year. You can also examine your own breast as we've been taught. You examine your armpit and so on daily or weekly. If you realize there is any form or lump or not, sometimes it's not a lump, you realize that the muscle is toughened, quickly go to the hospital, because cancer is not painful. By the time it gets to a painful stage, you are almost at 95 degrees towards death. So we should take advice, take good care of our lives. Life is precious and life is only once. To me, if it's 1.5, I will joke with the half and preserve the one, or I will joke with the one and preserve the half. But life is only one. When you lose it, that is the end.
According to the World Health Organization 2020 report, there is a need for concrete and practical guidance on the continuity of essential health and community services for NCDs. This is also an opportunity to utilize the development systematic approaches to digital healthcare solutions, focusing on COVID-19 related activities and continuing to provide essential services, and also to minimize an increase in morbidity and mortality from other health conditions. Dr. Beatrice Wiafi Adai gave the following recommendations that can effectively help in the treatment of non-communicable diseases amidst the advent of the COVID-19 pandemic.
So at this point, we are looking at COVID-19 and its devastating effects on the non-communicable diseases. And these are my recommendations. 1. Prevention. We need to prevent the non-communicable diseases. The preventable ones need to be prevented. We need to advise our people to do exercise, to eat healthy, to stop smoking, and to stop drinking alcohol. We also need to create more awareness. We need to have meaningful involvement of persons living with the NCDs to help us to create the needed awareness, to educate the people. We also need to come together as stakeholders, the government, the policymakers, Ministry of Health, Ghana Health Service, civil society organizations, Ghana NCD Alliance, and the other corporate bodies, private sector. We should all come together and do what we can to reduce the number of people dying from the NCDs. And we know that people with NCDs are more vulnerable to develop the COVID-19, and they are also more at risk of dying from COVID-19. So as we look at COVID-19, let's also not forget about the non-communicable diseases. If we are able to do this, we will by all means not lose the fight against the non-communicable diseases, even in the COVID-19 era. I also want to extend my hands to the media. Thank you, GTV, the other media houses. It's good that we are talking about COVID-19, but please, let's talk about the non-communicable disease, because we are losing a lot of loved ones. So talk about the other non-communicable diseases: hypertension, diabetes, stroke, sickle cell disease, mental health, cancers. They are all killing a lot of our people, our loved ones. So let's join hands and do what we can. I also want to invite the research institutions, the universities. They can help us to do the research into these NCDs, to know our data, to know what is prevailing in which communities, in which regions, which areas, and see if we can actually identify what is causing the surge in one non-communicable disease or the other. So the tertiary institutions should please come on board and let's do research into these diseases. The other organizations, WHO, we have the WHO Africa, they have an office in Ghana. We have the UNDP, we have other corporate organizations who can all come together. I'm also stretching my arms as the chairperson of the Ghana NCD Alliance and the president of Breast Care International to our diplomatic missions. I know that in the countries of most of them, they fought the non-communicable diseases to some extent. The advocacy is high. Their healthcare systems are high. And so they know how things are done. If they could come on board, if they could join hands with us and support us to do some of the interventions that we can do to reduce the number of people dying from these NCDs, to also create more awareness, to screen for the diseases. If we are able to do this, we can get people at the earliest onset of the various diseases and treat them, so that our people, the number of cases, the mortality rates in the country will reduce drastically. So I'm also inviting the private sector, come on board and let's work together. prevention, they say, is always better than cure. And we can prevent a lot of these diseases if we create the needed awareness. We encourage people to exercise. We encourage people to eat healthy and provide them with the healthy diets, the fruits and vegetables. Sometimes they are not affordable to a lot of people, but we can do certain things to make it affordable and accessible to all. And if we can help reduce the number of people drinking alcohol in our country, it used to be from 8 p.m. for the media houses to start advertising. 8 p.m. the children are still not asleep. So 8 is not late. Can we push the time backwards? Can we do other things which will just not encourage, especially the youth, in indulging in cigarette smoking, shisha, and alcohol drinking? If we are able to do this, it will help us to reduce the number of people developing the non-communicable diseases.
GTV is appealing to players in the health sector not to turn blind eyes on non-communicable diseases in an effort to contain the COVID-19 disease and pandemic.